Hi, today we're going to be going to do a real life simulation of what doing blood pressure is going to be like, because I feel like as a nurse it's really important to let your patients know where they can monitor these things like high blood pressure, low blood pressure, because a lot of people can't afford to go to the doctor once a month or once every 6 months. So as a nurse, it's your job to inform your patients of preventative measures. So one way you can do this is go to different stores like Walgreens, Walmart, Target, where they provide blood pressure monitors for you, so you can check out how your blood pressure is doing, so you can see whether or not you need to make a doctor's appointment. So in explaining how to do or measure blood pressure, we're going to go to a store today to kind of go on an adventure to show you how you would do that without even needing to go to the doctor necessarily, because once again, as a nurse, I feel like it's important to create preventative measures for your patients. So we are going to go drive there right now. Alright, so we just arrived at Walgreens where we're going to be measuring our blood pressure, or my blood pressure technically. But I thought it'd be important to go over what blood pressure is before we go ahead and go measure it. Blood pressure is basically your systolic over your diastolic. Systolic is kind of like the big pump, and diastolic is your little pump that's coming from the left ventricle in your heart. The left ventricle is the ventricle that's going to exceed or export, or whatever, however you want to say it, the most pressure when it comes to your blood pulsating through your body. So it kind of shoots out of your heart to have enough pressure to go throughout your whole body. So systolic is like that big push. So it's like your aorta is kind of constantly pulsating, and the little one is the diastolic, so it's the recoil, and then the big coil is your systolic. So we're just measuring the blood pressure, which is the resistance up against your arteries throughout your body, and you want that to be at a moderate level all the time, because if it's high, it's your kind of like your silent killer of the heart, because it presses up against all the walls in your arteries and your heart, and it makes them weaker, and you want your heart to be strong, so we want something in the middle. Something too low can cause a lot of fatigue, and you can randomly pass out. It's not necessarily a bad thing, but it can just be kind of annoying. And high blood pressure could stem from like atherosclerosis, or it could be a sign that you could have a heart attack. So you want to kind of measure that. It could be a sign that you have high stress levels in your life. So it's good to go ahead and do stuff like this to monitor your blood pressure to prevent all those things from happening. So we're going to make our way inside, and I'll see you in there. So this is the blood pressure monitor that we found in the store. It does a bunch of different health assessments. So you can do a diabetes test, health age assessment, blood pressure, weight and body mass, just a bunch of different things for preventative measures. So we're going to do blood pressure today. So we got to agree to a little policy just in case I die while this happens. Alright, we're going to do my date of birth, so you know my age. Yes, I'm legal. Don't know why this has to do with anything. Alright. So it's good to sit up straight because you want everything to be flowing correctly, and you want to make sure you don't have thick clothing on. So I'm gonna take this off. Don't want to talk, so I have to be quiet during this, unfortunately. You go ahead and press go whenever you're ready. So I'm sitting up straight, I have my arm in there, everything's level, so I should get a pretty accurate reading. Right now I'm talking, so it might be a little higher than usual, and I'm stressed out, so let's see what happens. This is not saying anything to me right now. Okay, here's our results. Results. So my blood pressure right now is 121/68. My pulse pressure is 53, and then my pulse is 77, which is great because that means I'm healthy. My diastolic is awesome, and then my systolic is fair. Normal systolic is gonna be like 120. I would say it was a little higher just because I've been walking. I'm a little stressed out. It just says a bunch of things. What is blood pressure? Why is it important? And then the different aspects of your blood pressure health. So since I'm good, I don't necessarily have to worry about that part of my health, but it's still important to go to the doctor at least once every 6 months. But this is a great way and a free way to check if you're being healthy. So we can look at these results one more time. Blood pressure, anything above this may indicate that you're a little hypertensive. So you might have to change things in your diet or your day-to-day activities to reduce stress, or reduce salt intake. I have problems with that sometimes. So yeah, this is a really cool thing to do if you can't afford to go to the doctor a lot or if you don't have health insurance. And I would suggest it for anybody. So I can even email the results to myself just to see what's going on. It'll work. Oh. Great. We'll do this later. But yeah, that's a cool way to do it. So now that I've assessed what I have, I'm fine. So I just can keep exercising, do what I do every day. I think I should probably still reduce my stress a little bit. But yeah, if you were hypertensive, like I said, just maybe exercise more, relax a little bit more, maybe take some diuretics, ask your doctor about that. Or if it's low, you might have anemia, or you're just extra healthy and don't need to worry about it. So this is a great way to measure blood pressure.